The safe use of medication is crucial in healthcare service. The Institute of Medicine estimated in the United States, on average, a hospital patient is subject to at least one medication error per day. There are different definitions on medication errors in the literature. However, identifying errors occurring during medication delivery is important because health system, the patients, as well as healthcare providers may all contribute to the errors. The Joint Commission International identified lack of training as well as communication failures as significant causes of medication errors. In Indonesia, little is known on medication safety as well as pharmacists' involvement in ensuring the safe use of medication. Although the Indonesian government has supported pharmacists' involvement in healthcare delivery, limited is known on how this policy has been implemented in practice. In this study, we aim to determine the nature and frequency of medication errors occurring during medication delivery in a ward in a public teaching hospital in Bali, Indonesia. This 20-week prospective study examined medication errors occurring during prescribing, transcribing, dispensing, as well as drug administration, which were detected through clinical pharmacy services. These services include medication reconciliation, medication chart review, clinical review, and patient's discharge counseling. 770 medication reviewed with 7,662 drug doses from the 92 geriatric inpatients participated in this study. 1,563 medication errors identified, which gave an error rate of 20.4%. Almost 60% of medication errors were error during administration. It was followed by 15% in transcribing process, 14% in dispensing, and 7% in prescribing stage. The majority of errors during administration were error during documentation. Of these documentation errors, 2% were potentially serious and 9.5% were potentially significant. The investigator also intercepted 8 errors during drug administration and 24 errors during dispensing stage. The high administration errors identified in the current study may have resulted from nurses' high workload, which range from administering medication, transcribing, documenting, as well as completing patients' paperwork during admission as well as on discharge. This study found that medication errors occur in every stage of medication delivery. This study suggests pharmacists to provision of clinical pharmacy services could potentially play a significant role in preventing and detecting medication errors, thus it may improve patients' outcomes.